Well, throughout this pandemic, medical professionals on the ground and in the air have been caring for COVID-19 patients. Here to share some of their observations from LifeStar is Trainor. He is a flight nurse and paramedic. Thank you so much for being with us today. We really appreciate it.
Thank you for having me.
And as we start out here, just wondering, what kind of role does LifeStar play in this pandemic?
So our role is primarily critical care transport of these critical patients and providing air transport to a higher level of care facilities. We've also been involved in decompressing facilities such as in New York, where the numbers are staggering and they are just task saturated and overwhelmed.
I was hearing that you were part of one of those missions going to New York City and involved in the evacuation of some patients. Tell us what that was like.
So it was a multi-organizational effort coordinated through Air Methods in partnership with Hartford Hospital and Bay State Health. They had 28 patients they needed to evacuate out of Jamaica Hospital due to a concern with the oxygen system. They weren't able to deliver the oxygen to the patients who were on ventilators. I was told there was about 75 patients on ventilators there, and the system just couldn't handle that. So we were coordinated to fly. We're just a small piece of the pie, but to get one of those patients out of there to an outside New York hospital. So we flew to JFK and took a ground ambulance into Jamaica Hospital and were able to evacuate successfully one of those patients to Albany Medical Center.
And in being in that hospital, have you ever seen anything like that in your career thus far?
Truly not. It was truly, there's a lot of heroic measures going on there. You know, they're working through it, but yeah, it was definitely a very enlightening experience, to say.
Is it what did you observe there? I mean, is it, you know, we've been hearing a lot about how, you know, the hallways are very crowded and you know, they're really desperate for equipment. When you were there, what was the situation when you walked into that hospital?
So truly, there were a lot of patients everywhere, and I would say that. The way that it was organized, though, was pretty strategic. When we arrived, we were given a name of a patient. We had no idea who we were taking or where we were going, but you know, each step of the way, New York seemed to have it pretty well handled. They were able to direct us to where we needed to go. That we safely found our patient. The nurse was, you know, very, very helpful in helping us transition his care. And, you know, on the way out, they checked us to make sure we had the right patient. It was, you know, it was a little chaotic, but I would also say that I really admired the degree of organization they had there, and they're definitely working through it, and I commend them for that.
Yeah, the healthcare workers are truly the heroes in this crisis, and all the people on the front lines, of course. What kind of precautions are you taking for the patients while transporting them?
So our precautions are, so it's a pretty extensive process, and it evolves every day. We start with a pre-transport huddle, so we actually slow down with these patients. Our lift times are a little bit delayed just to make sure that we have a good picture of what we need. We try to minimize the amount of equipment we take into a facility. We'll actually strip equipment out of the helicopter knowing that we're not going to use it, so less for us to have to decontaminate at the end of the transport. We talk to our supervisor and communications center, and we usually do a bedside report with the facility, especially if we're coming out of an intensive care unit. Some of these patients are very complicated. We even had a patient recently that we had to transport on their belly. So just discuss what precautions we would take. We use all the protective equipment that others do. We have the N95 masks, the gowns, the goggles, eye protection. We use our visors on our helmets as a secondary method of protection. So we're pretty adequately protected. The pilots are also flying in the cone of danger, so they all are also wearing the appropriate equipment while they fly the aircraft, which I give them a lot of credit for that as well.
Absolutely. Sean Trainor is a flight nurse and paramedic with LifeStar Helicopter. Thank you so much for the work you're doing, and thank you so much for being with us today. We appreciate it.
And thank you so much.